Hey, my name is Luke Schellenberger. I'm an ENT doc. So patients occasionally come in and they've broken their nose. They've been playing baseball and baseball hit them, or they were hit in a fight, or they fell. There's all sorts of reasons why you can break your nose. It's kind of this pointy thing that sticks out on their end of our face, and so it's a lot of times it's the first thing that comes in contact with something hard when we're in a trauma. And patients a lot of times ask, well, I broke my nose. What do I do about it? Well, the biggest thing is, does it look funny? Because, as opposed to our arm or our leg, muscles in our arms and our legs are pulling those bones apart all the time. And we're using our arms and our legs to lift things and move around. And so pretty much most fractures have to be put in a cast or set so that those muscles don't continue to pull them apart. Well, that's different than the nose. The nose doesn't have muscles that are pulling it apart. And so a non-displaced fracture, we don't need to do much about. And for a lot of patients, they come in and they say, I went to the emergency room and I got an x-ray or a CAT scan and I've been diagnosed with a nasal fracture. What do I do? Well, if your nose is still in the middle of your face and not deviated to either side or deformed in some way, you don't really need to do much of anything. That said, there's a fair number of patients that come in and it's pretty obvious their nose is broken and it's off to one side. Well, in that situation, we do a pretty simple surgery called a closed reduction. Now, closed reduction is really simple. Basically, we're getting the bones back where they're supposed to be. It only takes about 10 minutes and we put a cast on or a splint on the outside of the nose and works about 95% of the time or more. It's really pretty uncommon in my experience that patients who have had a closed reduction say, man, I don't like my nose, it needs something more. That said, there are other times that we'll think that we need to do something else to the nose. Sometimes if a nose is broken, the inside of the nose is broken too, what's called a septal fracture. And sometimes those are a little bit more involved because, well, if you've got a septal fracture and your septum is very deviated, we may want to straighten that up at the time of the surgery. And there's sometimes patients come in and they say, oh, I broke my nose 3 months ago. Well, you can't just do a closed reduction after a certain period of time. It's in average somewhere around 14 days that the nose fuses enough that we can't really easily put those bones back together. And so if somebody's had a nasal fracture, probably the most important thing is timing. You don't want to wait 3 or 4 weeks and be like, all right, now it's time to go in and see my doctor about my broken nose. No, you got to see somebody pretty quick because the sooner it gets fixed, the easier it is. And again, after about 2 weeks or so, it's not going to be fixed very easily. It's not to say that you can't fix a broken nose after 2 weeks, but it requires a lot more of a surgery, typically something called a rhinoplasty. So in general, if you've broken your nose, one, don't worry about it if it is not significantly deviated to either side. If it's not really deformed, I wouldn't worry too much about it. But if it is, you do need to be seen relatively quickly so that it can get fixed pretty quickly. All right? So, got a bad broken nose, somebody says you need to go see an ENT, come see me, I'll get it fixed up. Okay?